Let's talk about inflammation. Inflammation is an important problem affecting anybody, but we have solutions. Natural occurring solutions. At OAFI, we've been talking about SPMs for a long time. Today, talking to us about the resolution of natural inflammation is Dr. Malena Hawkins, doctor on Paediatric Endocrinology and medical director of Solutex Corp. Dr. Hawkins, welcome. Yes. We also have with us, it was written down here somewhere, I had forgotten of my dear friend Rosé. Rosé is one of our dear friends at OAFI. Well, good afternoon to you all. I would like to thank Dr. Vergés and OAFI for inviting us to spend some time with you. We are a company from Madrid. I will tell you a little bit about what we do, but above all, I want you to remember 3 words: resolution, inflammation, and natural. These 3 words will accompany us throughout our presentation, and you will soon understand what these SPMs are all about. And then Rosé will tell us about her personal experience, and if you have any queries, any comments, I will be happy to address them. In a congress of patients suffering from osteoarthritis, it's really important to deal with inflammation. Inflammation is at the core of this pathology, not being able to go up and down stairs, not being able to get into and out of a car, not being able to get into the shower and getting out, or just picking something from the floor. All of this pain is caused by an inflammation. And in this presentation, we will also refer to arthritis. It's included as a pathology too, but there are many others that present with inflammation, such as self-immune diseases, Alzheimer's disease, asthma, obesity, diabetes, depression, vascular disease. Many have an inflammation at its base that cause this pathology. What is inflammation? Inflammation is the body's response to an aggression that can be of different kinds. It can be a physical aggression, trauma. It can be a microbiological aggression by a virus or a bacteria, or an anomalous response of the body, for instance, to a reaction to self-immune diseases. After this inflammation, this aggression, there's an inflammatory cascade involving several molecules and pro-inflammatory agents from the arachidonic acid, a fatty acid. These mediators are leukotrienes, prostaglandins, thromboxanes. All of this is pro-inflammatory, and it unleashes the inflammatory cascade. The inflammation process must be triggered as a response by the body, but it should be limited in time. What makes it limited? Well, we have SPMs, as we saw. These SPMs will be in the body, and they will be specialized pro-resolving mediators, that is, specific molecules addressing the inflammation. Why do these diseases become chronic? Sometimes it's because of the diet, as we saw this morning, because of excessive exercise, or being sedentary, bad nutrition, tobacco, alcohol. All of these factors make this inflammation to perpetuate and become something chronic. A Harvard scientist, Dr. Charles Serhan, is a partner of ours, and he started to ask himself, what is the resolution of the inflammation? How can this inflammation be resolved, and why sometimes it is made chronic? He reached a series of conclusions, such as the resolution of the inflammation is an active process. It is not a passive one, resolving by itself. It needs mediators resolving the inflammation, and these are our SPMs. And they mainly derive from natural molecules, fatty acids, ingested by means of the diet, which are EPA and DHA. And this resolutionary activity can be measured in cell assays. It can be measured and we can know what the resolution is. This is Dr. Serhan, one of the most quoted authors in the US on immunology, pharmacology, toxicology. He's published hundreds of articles related to this topic and he works in Harvard University School of Medicine. He publishes in journals such as Nature, the Journal of Biochemical Investigation, Immunology, Toxicology journals, very prestigious journals where he speaks about this resolution of the inflammation and these molecules called SPMs. He asked himself, why would the inflammation come to the stop? Why would everything come back to normal? What are these signals stopping it? Or what endogenous mediators put a stop to inflammation? After that, he researched and discovered that the inflammation has two stages, an acute one, where we see the beginning of the inflammation with the involvement of these pro-inflammatory mediators that we mentioned before, prostaglandins, thromboxanes, etc. And then there's another stage, the resolutive stage of the inflammation, also an active stage with the involvement of SPMs, the specialized lipidic mediators, which allow the body to go back to its previous position, homeostasis, for the tissue to regenerate and to resolve the inflammation. If this inflammation is not resolved, it could become chronic. And this is when we can intervene. We can make this inflammation not to become chronic, but to be resolved by means of natural means. My colleague this morning, Dr. Miquel Sanchez, said that ibuprofen could not be used during the days prior to the extraction of plasma mediators, of PRP. Why? Well, because the anti-inflammatory drugs we used backtrack the inflammation. It's a step back. But now, however, the new lipidic mediators promote the resolution of the inflammation. And ibuprofen stops it, but it also stops the resolution of the inflammation. With these SPMs, we can only promote the resolution of the inflammation. Why are they natural? Why do we say natural in the title to this presentation? Because they result from the fatty acids we ingest in our diet, the omega-3 fatty acids. We have alpha-linoleic acid, DHA, and as a result, these molecules, SPMs, which act directly in the resolution of the inflammation. They are distributed throughout the body. We have SPMs in our brain, in our vessels, in the placenta, in the milk, in synovial liquid. SPMs are to be found throughout our body. Along with Dr. Serhan, this scientist from Harvard, we implemented a lab in Zaragoza where we measure these SPMs, where we are capable of measuring how many SPMs there are in the different fluids. And we use this data to conduct research, clinical trials, and several research methods, supporting both universities, public institutions, and private ones. We cooperate with them so that they can know what is the current status of the patients when it comes to inflammation. In addition to this scientific support, we have also been able to encapsulate SPMs. Monohydroxylates have been encapsulated so that they can be supplemented to patients. Actually, this is the case in the US and in Spain too. In Spain, supplements are being given in this form to patients. By doing so, we restore SPM levels, and we have enough so that our inflammatory state can be reduced, improving resolution, assisting tissue regeneration, eliminating cell detritus without adverse effects. No adverse effects, and it does not cause immunosuppression because it's a natural thing. They are applicable applicable to any condition where there is an inflammation. All of the cases we saw at the beginning, but mainly we are focusing today on osteoarthritis. So it can also be applied to osteoarthritic patients. And as we can see on the screen, they can be used for bone, musculoskeletal, neurological, and many other types of injuries. It is recommended to take between 2 and 4 pills or capsules a day. They can be in 1 dose or 2, and especially at acute peaks. And then, if the resolution of the pain is better, 2 can be taken or even just 1. Several papers have been published in this regard. There is scientific evidence of this product, of this resolution of the inflammation, in addition to the publications of Dr. Serhan. These, in particular, are relating to this product, SPMs, supplementation. We see how when administering the product orally, there is an increase of SPMs in blood increase, and how patients see a reduction in pain, or how there are differences between patients with a vascular pathology and healthy patients, or even with obesity. After administering the supplement, we see an increase in SPM levels. Bear in mind, obesity is an inflammatory state, and we see an improvement following the administration of these supplements. In addition, and in cooperation with OAFI, with Dr. Vergés, and football teams such as FC Barcelona and Athletic Club, as well as Atlético de Madrid, we've conducted a study called the Gaudi study, where we studied knee osteoarthritis in various patients, as well as the effect of supplementation of this product, SPMs. We have been able to see, well, this is the design of the study. The study was carried out over 12 weeks, and then a visit was done subsequently after a period of 3 months without taking or ingesting the product. The results show that there is a decrease in pain. In the EVA scale of pain, pain decreases considerably, down to 50%. The results have not been published, but we are about to do so. And the results say that pain in those patients who take SPMs is reduced down to 50%, whereas in the placebo group, as Dr. Vergés said, there's the placebo effect that needs to be considered. In the placebo group, there's only a decrease of 28% compared to the 45%. There has been no neglect of the patients because they were all happy with the way the product was working and they wanted to continue, and there have been no adverse episodes. So we are happy with the results, and these back all the previous findings. Moreover, in the lab, we looked into the reflection in the blood of these mediators, and we have seen there's a correlation with the reduction of pain and resolving D4, D2, with VRX, which is a protein, and there's a greater correlation with improvement of quality of life and with a reduction of pain. So we have already found statistically a clear correlation. Furthermore, as you can imagine, and as I mentioned previously, we can intervene in different inflammatory states. COVID would be one of those. COVID is a pro-inflammatory state, and there are some papers that show that during acute COVID, a mediation of lipidic mediators was made, and now we have an essay in the region of Aragon where they are conducting a study with persistent COVID, administering SPMs. Administering these supplements. Next year we shall see what the effect is in this patient population when it comes to quality of life, functionality, and they are also being assisted with rehabilitation. So it will be a great job. You can even focus on the clinical guide for providing care to COVID patients. They are also recommending the use of these lipidic mediators, these SPMs, 18-EPER and 14-HDHA. We already know that they resolve the inflammation, and this is all set out in medical guidelines. As a result, on this scale, where we have pro-inflammatory mediators and pro-resolving drugs, if the scale is inclined to the left, there will be more inflammation, more diabetes, more obesity. Whereas if the scale falls down on SPMs, resolvins, protectins, and mycins, there will be a better resolution of the inflammation, and we will be able to resolve that inflammation to avoid this inflammation from becoming chronic. As conclusions, we can say that osteoarthritis in Spain has an incidence of up to 30% of the population. It especially affects women, and it increases with age. More than 500 million patients worldwide and more than 7 million patients in Spain are affected by osteoarthritis. The lack of production of SPMs based on their precursors, EPA and DHA, could put a stop or slow down the resolution of the inflammation. And if we assist with oral supplementation, we can see an improvement in blood levels, and we assist with the resolution naturally. Therefore, oral supplementation by means of SPMs can be useful for patients with OA, since, as we have seen, it reduces osteoarticular pain and it improves functionality. Now let's ask Rosé what she thinks about this product and how she has seen this supplement, what has been her experience. Let's have her explain to us what her treatment has been like. Well, the truth is I am very much in favor of this supplement, especially because it's natural, and as a result, there is no negative effect for my body. And in my specific case, I was just fine up to Epiphany this year, beginning of January, when I had to go up 4 stories in a very old building. You know, those buildings in the Gothic quarter of Barcelona where there are no steps that are exactly the same as the previous one. So I went up, then I went down again. Nothing happened to me. But after a few minutes, I had to go up again, which I managed, but on the way down I had to hold myself from the handrail because I felt really a lot of pain on my right knee. After that, I started noticing things, problems, especially when going up the stairs. I used creams such as Voltaren and things like that. Obviously, they did nothing to me. I was well advised to try Pro-Resolve, and I took that during 3 months. This was March, April, and May. And the truth is, I felt an improvement. I hardly have any problems now when going up the stairs. The pain is almost gone. Although I must acknowledge that a month ago I went out on a trip. I went hiking from sea level to 400 meters high, 15 kilometers. I was walking for some 3 hours, and when I got to my destination, that is when I got back home, I started to feel some pain around the left side, the internal side of my right leg knee. So once again, I'm back to taking Pro-Resolve. I've been taking it for 2 months now, and I don't know whether it's this supplement or it's my head. How much do you take? I take 2 a day, 1 every 12 hours, 1 with breakfast, 1 with dinner. And the truth is, I've been taking EPA 900 for some time. This was sold to me, quote-unquote, by saying this was the lubricant for the bones. And I imagine that this must also help me. So I am very much in favor of this product. As Rosé just said, EPA is also a precursor in this chain, but EPA and DHA are more focused on the structure of the cells in the brain, the heart, the vessels, and SPMs focus more on the inflammation and the resolution of the inflammation. And I'm happy because I was able to go up and down these stairs here, and I just walk as much as I can. I tend to do 8 kilometers a day. No problem. And prevention is also something important. We need to focus on prevention. Now, do you have any other questions from the audience?
Me voy acercando mientras levantan alguna mano.
Well, if I may, I do have a question. I'm here. Yes, José Luis, go ahead. You insisted on something which I think is important. It's not a trivial issue. This is a rather natural therapy that we're talking about. There's a problem amongst patients, which is we shouldn't focus only on the disease. The patient may have other pathologies too. So a therapy like this, in a therapy like this, have you found any incompatibilities or interactions with other drugs? Interactions with other drugs? No, this is natural therapy. This is something we can take in our diet in the form of essential fatty acids with the precursors, but with these, we go straight to the mechanism of the inflammation to resolve the mediation, the inflammation. There's no interaction with drugs, no adverse effects. It can be taken as long as is needed, and it's a natural drug. It does not interact with other drugs the patients may be taking. Actually, in the study we presented, the patients did not need to take salvage drugs, rescue drugs. We thought there was a need for that, but the patients did not need to. We are used to having patients with OA to take rescue medication to resolve their pain peaks, but there was no need in this case. Dr. Osvaldo Castañeda from Lima, Peru, will be talking to us OA and arthritis. Please ask your question. Thank you. Yes. It gives me joy to listen to you, especially at the beginning when you referred to the inflammation by saying it was a reaction to an aggression. This is very important because not even with the pandemic, most professionals in healthcare were able to understand that. Whatever the inflammation caused by the immune system, is caused by this immune system. That's the important emphasis. We all need to understand that. There is no inflammation if the immune system does not react against an aggression received by that person. And in relation to that, when you said that COVID is a new disease, this is not true. COVID is not a viral disease. COVID is a viral infection like many others in history that triggers a self-immune reaction and it transforms into a self-immune disease. Obviously, there's inflammation. But inflammation is like a fire. If a fire sparks up and we just look at it, the fire will extend and cause damage. This is what the bad thing here is not to provide a treatment. And the viral stage, the inflammatory stage, after 3-4 days, the fire starting spreading. And we had to put it out with all of our strength, not just looking at it or give paracetamol. And I've been fighting against many because my specialty is immunology and rheumatology. We all study at school, but we only focus on the basics. And then, unfortunately, only some immunologists or some rheumatologists know what to do. But the other thing I want to say is that the inflammation is really complex. The immune system is like the armed forces. There's an army, there's the navy, there's the police. So the immune system has many cells and substances that are involved, and when it is out of control, it is so big that, on the one hand, it can be controlled, but when other parts are neglected, then we cannot achieve full control. That is why I wanted to ask you if you've conducted an assessment on those patients of the microbiota and the levels of vitamin D. In my presentation, I will be talking about why vitamin D is so important. But if you have not done it, it might be interesting. If there is something I try to do, is to look for the full resolution to a problem. I'm not interested if a patient has arthritis, a treatment that improves 50%. The doctor needs to be in the shoes of the patient. If I had arthritis and I'm given a medicine that improves 50% of my joints, what about the other 50%? It's not useful. If I have this vision, I demand a treatment resolving the problem of the patient in 100% of his body. And apologies for going on about this, but this is what I try to insist on wherever I go. We, the doctors, need to make sure that patients improve at 100%. Not even 90% is acceptable to me. This entails an effort in looking for that other thing that can help us, giving back the true full life.
Yes, as you were saying, microbiota and vitamin D are also things that help in the pro-inflammation state of patients with osteoarthritis and other inflammatory pathologies, and it's very important. We are working with the Complutense University in Madrid, who have a very important group on microbiota and the study of the microbial flora related to microbiota, and that's what we are working on. And of course, we will cure the patient 100% with a little bit here and a little bit there, and doing whatever we can. As we heard this morning as well, Miquel Sanchez said, if we start, the sooner we begin, the more results we will see. So let's not treat the process when it's highly evolved, but rather in the initial stages. Let's do something about it so that the resolution of inflammation is full. And we avoid becoming chronic. Yes, in OAFI we have experienced those phases. I remember we didn't speak of COVID until it was official, but some of the studies were taken to that pathology. So I understand that for example, the Gaudí study is not closed yet. Yes, thanks, Ricardo. I want to congratulate you for your presentation. I fully agree with what you said. The clinical trial was done in high-performance centers. The clinicians that participated, tomorrow you'll see Dr. Amolet, Dr. Boal, many who participated with football players of Atlético de Madrid and other football teams. Barcelona football team as well. Dr. Rodas, who's the doctor of the Spanish national team. It was a double-blind study with one placebo group, and this was during the pandemic, unfortunately. It was very complicated to do it in all patients. But in any case, what we saw is what is our perception in this level of scientific research. The perception is that it is a product, a supplement, or however you want to call it, which is harmless to begin with, which is very important. it's not something we can say about many drugs with osteoarthritis. Anti-inflammatories can be damaging, and the painkillers as well. Fentanyl, I mean, we give them because of their efficacy, but this is harmless. We've seen a good response, as you said, and this morning we said...
Y tú lo has dicho ahora mismo, contra más pronto lo demos mejor. Esto es un concepto muy importante.
The more, the better. This is a very important concept we should all understand. Osteoarthritis, the more we control it, the better. If it's very advanced, we will have problems because inflammation is out of control. Clinical pharmacologists have an experience with subgroups of patients, and in osteoarthritis you have the same. If you take a patient with a grade 2 knee osteoarthritis, it won't be the same as another one with the same grade, because maybe one has the subchondral bone affected, others the synovial membrane, others other bones. There are subgroups of patients, and most likely the treatment will have to be mixed. So this is something else that we have to do. Perhaps some patients, SPMs would be enough. In others, we will need chondroitin with SPM, or others will need hyaluronic acid with something else. This is what we call the clinical experience, and we have to explain to the patients that we are not magicians. So an association could be very interesting because there's a theory, as you explained. There's a lipidic theory of osteoarthritis. There are subgroups of patients who have their lipids altered. Very likely, it's a hypothesis. And if that were the case, we're analyzing the analytical and biochemical parameters to see the relationship, biochemically speaking, between the metabolites and the activity. Yes, we do see a correlation between some metabolites which are more active in these patients. In any case, something I think is important to say is that, well, I have to say congratulations for your efforts, because a clinical trial, double-blind, with so many patients, 4 hospitals, I mean, but it is, of course, the only way to see whether a product works with evidence-based medicine, and it's very important to see everything is well controlled to see if it works or not. But taking into account that the osteoarthritis doesn't have much solution, having a product like this which is safe, it's very promising. And as we heard this morning, inflammation in osteoarthritis might affect other organs, the kidneys or other organs that might be involved in this. This would help resolve inflammation in the body in general. Very quickly, a few years ago, I worked in a very interesting project that had to do with EPA and DHA. I'm talking about 25 years ago. And we did see something very interesting. DHA, as a precursor, did something interesting. In small children who we gave formula milk, their brain development, neuronally speaking, was very interesting. And on the other hand, automatically the children who had taken those milks enriched with those DHA had less immune problems, less asthma. We had no idea why this happened. I didn't know. I just remained with the EPA and DHA, but in the industry in general, I have to say that there's an abuse of fats in general. The ones that are not DHA, double bonded fats. And so we have a deficit of 2 things, of vitamin D and DHA, which is the precursor of practically everything. I didn't know about SPMs, but I'm not surprised to hear that they work, and I really appreciate this presentation. Well, I have to say that this is novelty. Dr. Sarham started publishing these papers in 2014, although the studies were done previously. So they are discovering in the retina, in women's health, at different levels, everything that has to do with inflammation. It's something that's very, very interesting. Very well then, you see the importance of inflammation and the control of inflammation with SPMs. Thank you. Thank you, doctor, and thank you, Rosé. Our volunteer patient.